Let's go to treatment principles and talk about qi regulation. Adjustment to person. This means that when considering which herbs to use in treatment, it is important for the physician to consider not only the characteristics of the illness, but also the patient's characteristics such as age, gender, underlying constitution, and lifestyle. Such personal factors must be taken into account in conjunction with the hour and local factors. However, comparatively, the personal factors are more salient than the hour and locale factors. This is because in the causation and progression of illness, the hour and local factors must act through the personal factors so that the complex pathological effects reflect the peculiarities of the person. The value of CM lies precisely in its recognition of the commonality of the many manifestations of any one illness while emphasizing the uniqueness of each patient. Personal factors are analyzed generally from the two perspectives of prenatal endowment and postnatal acquisition. Since humans live in society, the social circumstances affects them constantly. Such effects may be expressed at both physiological and pathological levels. The mind can readily remain healthy. In the converse, illnesses can occur easily. In a time of peace, the people are secure, content, well-fed, and warm. The main illness are those of excessive changes or overindulgence in sexual activity. In wartime and during social upheavals, illnesses of physical exhaustion and illnesses of the spleen and the stomach due to irregular diet are common. Also, when people abruptly switch from one circumstance to a drastically different one, the emotions often change, and the effects of such emotional changes must not be neglected. Since patients differ in overall size, degree of thinness or fatness, robustness, and propensity to warmth or coldness, when choosing a treatment approach, the physician must first determine the ampleness or deficiency of blood and the purity of qi. The ancient physicians categorized persons by constitutions as follows: those of high yin, those of low yin, those of high yang, those of low yang, and those of balanced yin and yang. CM posits that these five different constitutions predispose to different responses to the same pathogenic evil and affect the course of the illness. Thus, a person of high yang is at more risk for the generation of endogenous heat or fire, and a person of high yin is at more risk for the generation of endogenous cold. A stout person is more prone to illnesses of strength, and a weak person is more prone to illnesses of deficiency. In a person with dark complexion and yin deficiency, thinness of the body is associated with a propensity to generate endogenous fire, so that dampness easily transforms into heat and can damage the body fluids. The approach to treatment required is opposite of that for yang deficiency. Those who have a thick stomach, dark complexion, or large bones, or are obese are more resistant to poisons. Those who are thin or have a thin stomach are less resistant to poisons. Qi regulation is a method that is designed to correct abnormalities of qi regulation in order to restore qi movement in the body. The three applications are promote qi flow, lower qi, and raise qi. Promote qi flow is mainly applied to mobilize liver qi that has become stagnant. It also is useful in stagnation of spleen qi or lung qi. The lower qi in some illnesses, lung qi or stomach qi, ascends abnormally, causing such symptoms as hiccup, labored breathing, and mental disturbances in one case and vomiting in the other. By this treatment method, this abnormal ascent of qi can be suppressed. To raise the qi, this is applied mainly in illnesses in which spleen qi fails to ascend. It is often used in conjunction with strengthening of the spleen. Before applying this treatment method, ensure that the diagnosis is correct. If it is used when the proper treatment is to augment qi, it may cause further qi deficiency. Conversely, if qi augmentation is applied when the proper treatment is qi mobilization, qi stagnation may be aggravated. Thank you so much for your attention.